Very excited for my guest tonight, who I'll introduce to you now. Anahita Kashefi is a licensed marriage and family therapist, certified couples and sex therapist, and ketamine therapist, licensed in California, Utah, and Colorado. She specializes in ketamine and psychedelic-assisted psychotherapy, depression, anxiety, relationship issues, and issues unique to the creative field. She's had the privilege of completing advanced ketamine therapy trainings with Dr. Phil Wolfson, a leader in pioneering ketamine therapy, whom she now works with at his ketamine clinic in the Bay Area. She sees patients for ketamine therapy throughout Northern and Southern California and facilitates ketamine retreats in Utah and Colorado. In addition to her work as a psychotherapist, she also studied music and is a seasoned musician and performer. Welcome to the show, Anahita Kashefi. Thanks for joining me.
Thank you for having me.
Yeah, it's really a pleasure.
Likewise.
And I mentioned you do so many different things, but tonight we're going to focus more on the ketamine-assisted psychotherapy that you've had trainings and experience in. And it's something that I'm really excited to jump into and to get your expertise and experience in. But maybe we can even start bigger picture of just psychedelics, some of these alternative modes of therapy or medicines that have been used, because it really is, we're talking before the show, a movement, or really a movement back towards lots of medications or different plant substances that can be very beneficial. So maybe you can talk on just psychedelics in general and some of your thoughts on that.
Absolutely. So, yes, like you said, there is a huge revolution happening right now as people are rediscovering the benefits of these medicines. For a long time, from the war on drugs, Nixon era, they made these substances illegal when during that time, like in the 60s, 70s, 50s, 60s, 70s, they were actually doing a lot of research on these medicines and clinical trials and, seeing the benefits of it, and then got completely shut down. So now there's this reemergence. Everybody's talking about it. It's really exciting. Right now, ketamine is the only legal substance in the United States, the legal psychedelic that we can use therapeutically for now. I think probably in the next year or so, psilocybin and MDMA will be approved by the FDA for therapeutic use, which is very exciting for us.
Very exciting. Yeah, I think for us as mental health professionals, but for the whole public, because I've talked about this on recent shows. It's not to say psychiatric medications don't work. They help many people, but we also see the limits at times for certain treatments.
Right.
And it's exciting, to see new types of treatments, because you'll hear some psychiatrists or people in the field say we really haven't had big advances when it comes to psychiatric medications for quite some time.
Yeah.
But the psychedelics might be, again, it's like you're saying, a revolution. It's like a renaissance, bringing back something that was being studied extensively decades ago.
Right.
But now in the last few decades is having this big resurgence, which is quite exciting. And we talked before the show about How to Change Your Mind by Michael Pollan, a great book to get some insight into the history of this whole, as you mentioned, the war on drugs, and then how that led to this backlash. Timothy Leary and others who are at the forefront, and some of the things that they did and the reactions. Unfortunately, put kind of a freeze on decades, a decade's freeze on researching psychedelics, but it's really exciting to see this resurgence.
Yeah, it's so exciting to see the resurgence. And, yes, as you said, there are certainly plenty of medications that are beneficial and help people, and some, some don't. And so, finding, what can we do when, SSRIs don't work, or, certain medications don't work, when, why can't we explore alternative modalities of healing? Why psychedelic medicine? What is it? It's basically, exploring non-ordinary states of consciousness. and they go in places where the intellect is afraid to go. Zeroing in on blocks, defenses, constructions, dysfunctions of the mind, distortions that accumulate over time, and we have trouble breaking through these defenses because they've been intact for years and years and years to from trauma, for example, to help us survive. But then we get stuck.
Yep.
So what these medicines can do is provide clarity and openness, making it possible to reclaim your whole self. I think what is healing? Healing is acknowledging whatever that is, that trauma or that pain or that suffering. First, we have to acknowledge it. Then we have to feel it. Then we have to integrate it. Why do we have to feel it? Because when we feel things, we can discharge it and then be free of it. So sometimes these medicines can, if we're stuck, it can break through.
Yeah.
That.
Yeah, I think that breaking through. You talked about the ways we get stuck in certain ways of thinking, and in recent years, almost every book on neuroscience that I read talks so much more about how the brain is less a thinking machine and more a predicting machine. And so what we've experienced, everything we've gone through, creates these grooves that become we don't even realize they're there because they become so automatic, but they can be so self-limiting and hurting us and restricting us. And when you say, our true self or that authentic self, I think that's so beautiful. And it's not necessarily, to me, like there's this one self that we have, but that having that flexibility to break out of those grooves allows us to experience the whole human experience, where we all have different aspects of ourselves that we've probably closed off or don't think is okay, or if you want to, from a Jungian perspective, put in our shadow, that we can embrace,
integrate,
and it can be so hard.
Exactly. Even the shadow self, right? When we can allow that to live and breathe and understand it, and integrate that, I think that's when we're our healthiest. Yeah, I think to me, it's like some people think, well, should you be this way or should you be that way? Should you be assertive or passive or aggressive or more masculine or feminine, whatever that means. And to me, the goal is always that flexibility, that you have the whole repertoire of whatever it might be, because there isn't one way that's the right way to be in every situation. And so the more we have that flexibility, the better, we can have better relationships, first starting with the relationship with ourselves, and then, extending that outward. And as you said, the psychedelics, it's not that they just fix it completely, but they can allow for sometimes I think of it's like it makes you more flexible. Now the muscles can stretch more. Doesn't mean that you'll completely change, but it gives you that possibility for new openings. Right, that's a beautiful way of saying that. So it's that flexibility that maybe I can think about this thing that I've been thinking about the same way my entire life. Maybe I can think about it differently, and a new narrative, a new way of being. It can give us a break from our obsessions, our that way that we've been thinking for so long. And it's a catalyst. So it's not, like you said, it's not just the medicine that, although these medicines are powerful on their own, it's not that they are magic and will change you. It's like, well, once you get to those insights that are experienced through the medicine, how do we hang on to that? And having somebody that is experienced that can guide you through that understands how these medicines work, understand the framework, and help you stay on track. I think that's something that we definitely will be touching on tonight, is that, as you said, the medicines themselves do have powers, and people have experiences when they take them that can be very important, but it can be so much more meaningful to do as you're doing the ketamine assisted psychotherapy, doing therapy alongside, to really benefit or get the most out of the experience, to when these new things are
possibly opening up, or things are being shaken, or someone explained it to me. They said they saw, it's like grooves in the snow when you go over them over time, but then the psychedelic could kind of be like powdering. Yeah, I think you had mentioned that to me. That it becomes like it's like a new powdering the snow again, and now you can have the openness for new possibilities that might not have felt possible before that.
Absolutely. And the therapy portion is let's anchor to that. You realize that you can go this other direction. And so, a lot of people will have these, deep, profound experiences and insights, but when they don't know how to anchor to it and continue to work through it, which is the therapy part. That's work. We have to, if we want to change something, we have to put effort and we have to work at it. We can't, no substance is going to fix you.
Right.
No medicine is going to fix you. You have to do the work.
Yeah.
And so now that you've realized, oh my gosh, I can go this direction, and I actually can feel that, because with these medicines help you, it's feel the insight. It's not just, I got this message. It's you actually feel it. Now let's work on getting you there in this new narrative.
That's so interesting you said feeling, because I think obviously humans were so complex and there's so many layers and so many things going on at the same time. But often in therapy, you be with a client, you're like, oh, it seems like you feel this way because, your parent, something in your childhood that, and it's like kind of just in a semantic, logical, abstract way. And it has some impact. Yeah. But it doesn't necessarily change the way they feel. They're like, oh, I guess I'm like, scared of relationships because of that. But it doesn't mean now they're going to go embrace relationships because the feeling hasn't changed. And next time they're in that situation, that feeling is going to come up again. I'm like, oh, don't go that way. And so I think what you're saying is that this allows for some new feelings to come about that then if you process and work through can allow for you to take that going forward and turn it into action.
Right. And that's the transformation.
Yeah. And that's why I'm really excited for us to get into that, because one of the things I talk about therapy on the show a lot itself is that there's a lot of myths and misconceptions, and even some, it's almost scary for some people. I'm going to go talk to someone, and what are they going to do? And I think for things like ketamine assisted psychotherapy, I can see that might be even stronger, because we're like, what is it like? It might be a little bit scary for some people. So I think after the break, maybe we could you could walk us through a bit of what it looks like, maybe some myths and misconceptions, but also what to expect, so that people kind of know that it's not probably as scary as you might think it is, or you might be afraid it might be. So after the break, we'll continue discussing ketamine-assisted psychotherapy with Anahita Kashefi. We'll be right back. Welcome back. Again, my guest tonight, Anahita Kashefi, and we're talking about ketamine-assisted psychotherapy. But maybe let's focus on that first part of it, ketamine, because I realized we didn't actually say exactly what that is. So maybe you can share with listeners what ketamine is.
Absolutely. So ketamine is a medicine. It was first discovered in 1962, and it started being used as a general anesthetic in 1970. It's approved for use with children, adults, the elderly, pregnant women, which shows you that it's a safe medicine. Since then it's been widely used in hospitals for office procedures due to its rapid onset, short duration of action, and superior safety. It like I said, general anesthesia. It's also used to help with acute and chronic pain. It's used in the battlefield and emergency departments worldwide. It's an anxiolytic? Yes. Okay. Anxiolytic to help with preoperative and end-of-life anxiety. And we use it as a rapid onset antidepressant to treat chronic depression and other treatment-resistant conditions. It's the only legal hallucinogenic drug available to conduct psychedelic psychotherapy for now. So it's a little bit of background on the medicine.
Great, thank you.
When it's used in the hospital setting, it's used at much, much higher doses for anesthesia. So when we're using it therapeutically, it's like a fraction of the dose that's used in the hospital setting.
Yeah,
So,
I think that's a good point, because I think when people hear, oh, it's anesthetic, they think, am I being put under? But it's much milder, so you actually experience it more in that way. But yeah, thank you for some of that background. As you said, it's been used for decades and used even on children, so it is safe. But even still, as we'll get into the protocol, if you're doing ketamine assisted psychotherapy, even if you're doing that with the psychotherapist, there's clearances you're going to get medically to make sure there's nothing to be worried about on that end. And so maybe we can get into that. But we can also talk about, I mean, if you're open to it, I'm open to it, that I'm actually going to go through this process with you.
Yes.
And that's, how we connected, and then, all of this came about. And so I do want to be, first of all, that's maybe some level of vulnerability, just sharing that. But even as I'm talking on, it's like, hey, it's nothing to be worried about. I have some feelings of anxiety related to going through the process, because I haven't done something quite like that. And I'm trusting that it's going to be a good experience, trusting you and the professionals that you also work with. But I would have to be very frank and say, there's some anxiety that I experience when I think about doing that. And so I thought it'd be cool just to share that, so people here and I might actually talk about my experience afterwards. We'll see. I'd like to do that. But just wanted to share that. I think it's cool, and I appreciate you walking through that journey with me.
Absolutely.
And so as you discussed the process, I was kind of joking with you before that I'll be like listening both as the host and like a listener, like what am I going to go through, so I know what to expect. So I think I'm pretty excited about that, though.
We have a live patient here. That's willing
live patient.
To share
I'm not on right now. I'm not on it
He's
right
not
now.
on it right now,
just drinking water. But I'll be soon having that experience in a couple of weeks. But I think it's just a fun thing for people to know that it's scary at times, but it's okay.
I absolutely want to validate that experience. Doing something you've never done before is anxiety provoking, especially when you're going to be in a non-ordinary state of mind, and you don't have experience with that, with other medicines, psychedelics. So of course you're like, well, what's that going to be like? Am I going to lose control? Am I going to shout out my deepest, darkest secrets? What's going to happen to me?
Maybe all the above.
So,
thank you. I feel like this turned into like a therapy session for me all of a sudden. Thank you. That was very validating and soothing. There's some of that of like, I think a big thing for a lot of people with psychedelics, and I can relate to that, is like this sense of losing control, which can feel scary. But it's also, I think, a big part of vulnerability, and when you trust people and trust the world to be taken care of, there is some degree of letting go that is necessary. So I think going through this will be helpful for me in that way. And so there's multiple, I think, levels to it that I'm interested and excited about.
There's so much to talk about here. So so, first point, a really important point is, you, in order to do this experience, you should be doing it with somebody who understands, has been through it themselves, knows what it feels like, and is highly trained, right? You need to know what this medicine and this whole experience feels like, and if you're undergoing this process. So if you're a client that is interested in this therapy, when you're doing your research, you make sure that the person is trained and specialized in ketamine-assisted psychotherapy. There are a lot of places, unfortunately, that because it could be very profitable. Some clinics that popping up around the states. So you just want to make sure that who you're seeing, their heart's in it.
Right.
Because that's also a huge part of the experience, is that, the therapist that you're sitting with is really enthusiastic about this process and your transformation and your well-being, and knows what this experience is like.
I think it's good. I think when we get into the protocol, you can explain what that will look like for people and what to expect, what I'm going to get to experience and expect as well. But I think that's a really a good point that, people, I think anytime there's new treatments that come out, there are people that are going to make honest mistakes or like out of not knowing. There's people that will take advantage or try to profit or make it the most profitable, that might cut corners, and it'll be much less about the patient or client's experience and much more about the profit. And so I think you're right that it's important to be aware of who you're working with and people that are really approaching it the right way. And that's why I think it's good that you're going to share what it can look like, and not every clinic is going to look exactly like yours, but some of the basics that might be important to look for.
So my advice to everyone listening who wants this treatment, or for a family member or whatever, is that wherever you are seeking ketamine treatment, that there is therapy with it in conjunction with. They're not just administering the medicine, because you're not gonna you're gonna feel relief probably, but you're not going to have any long-term benefit because you're not using therapy around the medicine. So that's going to create some sort of dependence. Not that the medicine is has dependence, but you're going to have to keep seeking out the medicine in order to feel better, and that's not what we want. We want you to have the treatment and feel and have lasting change, and you go on with your life. We don't want you to keep continuing to come back and having to get the medicine without any sort of processing around it. So that's my advice to anyone who's interested in doing this. And
I think that is important because and I've seen different processes. I've even been involved in seeing how you manage that, and what I'm interested to hear from you is about what does that even look like, what the therapist, you in this case, do as far as when we talk about the assisted psychotherapy piece of it, because I'm sure it probably has similar principles to a typical psychotherapy session, but I'm sure in some ways it's also different, which we can look at. And I think something you mentioned earlier, another thing for me, first and foremost, I think I'm doing these things personally, these experiences I'm trying to have. But I also know as a clinician myself, if I'm going to work with people that have either gone through it, or if I want to recommend or encourage or talk about it on my show, that it can be meaningful for me to go through it. Just like as therapists, we have to go through our own therapy.
Exactly.
Even to just like graduate, from our graduate programs. But, it can really help to know what it's like to be on the other side of the couch, or the video call in some of these sessions these days. But so for me, I think it's important to experientially go through it to know what it is if I talk about it, because at this point I would only be able to talk about it in an abstract, theoretical type of way.
Yeah, right. It's like you're not going to go read a book about Taekwondo and then know how to teach people Taekwondo, right? You're going to go and experience this and really, really know and understand what that is like. And so, the question about the process. First and foremost, reaching out to a ketamine-assisted psychotherapist, so I can just walk through what my process is and how I do this kind of therapy. So if somebody were to reach out to me, first, you need to do a medical eval with a psychiatrist, MD, a psychiatric nurse, somebody who's specialized in working with ketamine. The reason why you need to do the medical eval first is to be assessed whether or not you are a good candidate for this kind of medicine or therapy. Make sure there are no contraindications. Psychologically that it's you're stable enough to do something like this. So you have the assessment. So like we're doing tomorrow, you're meeting with the psychiatrist I work with for an intake, and then from there we're gonna do if you're a good candidate for the therapy, then there are a few different ways that we work with this medicine. So there's something called psycholytic sessions. Psycholytic means low dose medicine plus talk therapy. That's a psycholytic session. So you and I could be sitting here. You would take the medicine maybe in a lozenge form 15 minutes before our therapy session. It takes about 15 minutes if you're taking it in a lozenge for it to feel the effects of the medicine. It's not a moderate or high dose. it's a very low dose where it's just enough for you to experience a softening of your defenses. And then we have a therapy session and we're talking while you're feeling the medicine. And it really helps you get to certain places where you might feel blocked or defended. So that's a psycholytic session. And then we can do something that's more of a moderate to higher dose of the medicine. And, there are different routes of administering the medicine. So I mentioned the lozenges.
Right.
There's intramuscular, which is IM. That's a shot. Or there's IV. And then there's also nasal spray, but we don't, no one that I work with that's specialized, we don't use nasal spray. There's also higher risk of dependency with nasal spray because it's so easy to just do it. And we don't want that. We don't use it. So, with, IM or IV, you need a doctor or psychiatric nurse to, administer the medicine. So with that, if you were coming into my clinic to do moderate to high dose therapy session, we usually book 3 hours for that because it's, we do about an hour of therapy intention setting. Why do we do intention setting? Because the frame of mind that you're in going into this experience is so important. And, the psychedelic medicines can amplify your experience. So if we are really cognizant about what is your intention and prepare it and treat it like a ceremony, because it can be a very beautiful and sacred experience.
Yeah.
And then when you're ready, we would administer the medicine. The doctor would determine what dose is appropriate. You'd have your journey. Usually you're lying down because ketamine's an anesthetic. You're not going to be walking around. That's dangerous. So you're going to be lying down in a comfortable place with eye shades on and music. And that's going to provide a deep experience for you. We're not having a conversation in this moderate to higher dose experience. Some people might say things when they're in their journey. If they do, take note of it and ask them about it afterwards. Most people don't talk because they just go really inward. But I've also sat with people that are talking the whole time. So it just depends on the person.
Yeah.
Everybody responds so differently when they're you're exploring your unconscious mind. You're so it's hard to say how you're going to respond.
Yeah. By the way, when you're explaining all that, I feel like we're about to start. You were so good at setting the tone and the context. I was like, all right, I'm ready. Let's start. But that was really good. But yeah, that's and when I think we're actually at our last commercial break, and didn't mean to cut you off in explaining that process, but maybe even I would be so curious to hear what as a therapist, is it different? I'm sure in a lot of ways you're allowing the client to express what's coming up for them, but is the focus different? How the processes, or what those at the lower doses, what those therapy sessions are like? If you're open to that, we can maybe get a little bit into what you've seen, what you've experienced, all that good stuff.
Sure.
All right.
Sounds good.
Let's go into our last commercial break. Again, my guest, psychotherapist Anahita Kashefi. We will be right back. Welcome back. Again, my guest, psychotherapist Anahita Kashefi. We were talking about ketamine assisted psychotherapy, and you were going through the process that first you would meet with a psychiatrist or a medical doctor to get the clearance from that side, and also make sure you're psychologically sound and a good candidate. And then you were talking about the sessions themselves, and there's different ways of administering, how to administer the ketamine. And then I was curious getting into the psychotherapy sessions themselves, and I'm sure each one is different and there's different people and so many different things. But if there's anything you can share about your experience doing this, because it's clear to me from talking to you that you're passionate about it.
Absolutely.
So that you've seen benefits for people. And so anything, you can share in that realm that might help people understand why they might want to consider this as a possible treatment for themselves.
Absolutely. Yes. Okay. So, I'll kind of jump in where we had left off, which was what is like a more moderate to higher dose CAP. CAP stands for ketamine assisted psychotherapy session look like. So, I kind of talked about, the journey. That's the effect of the medicine, which usually lasts about 45 minutes, sometimes an hour and a half. It just depends on the person's sensitivity to the medicine, but usually no more than an hour and a half, which is also another reason why we like using this medicine, because it's doesn't last 7, 8, 10, 12 hours like some of the other psychedelic medicines, right? You go in, you have your journey, you have your insights, and then you come out pretty quickly, and then the therapist is with you, waiting for you, and then we make sense of your experience. So that, again, more therapy. And then, that's what we call therapy integration. So we're going to integrate what you experienced into your life moving forward. What are you going to take with you? What did you learn? You had a timeout from your ordinary mind. This is an opportunity for newness. How are we going to use this to your benefit? So that's what the therapy integration portion is, and that's the most important part, in my opinion.
Yeah, and that's right after, like when they're coming. So
that's what we're going to do after in that kind of 3-hour block. But then, hopefully I'm meeting with you again, depending on how many sessions we assess, how many sessions we're going to start with, based on what you're coming in with. And, we're going to meet. It's hard for me to give you a number of frequency, but maybe you have 3 to 6 ketamine sessions, and we do maybe a couple months of therapy integration, for example.
Okay.
I'm just throwing numbers out because it's really unique
case
from
by
person
case
to person.
That makes sense. So but there's some that's happening while they're on the medicine, but then there's some that happen when they've come out of that and then processing and integrating it.
So sometimes I might see somebody once or twice a month for ketamine therapy. Like, let's say I see them once a month, and then I'm doing a therapy integration, a week later or 2 weeks later in between.
Got it.
So it really kind of depends.
Sure. Yeah. And I think we've touched on it, but I don't know if I asked you directly about what types of issues people would, ketamine gets, is used as a treatment for.
Absolutely. So many. So, depression is a big one. Anxiety, PTSD, OCD, and so much more than that, because anytime it can really help with any sort of blocks or plateaus that you might reach. Let's say you've done a lot of inner work, and you've been in your own therapy for a long time, but you reach this point where there's something that you're getting stuck in, and you can't understand why. That it will kind of help that hump. I had a client that I adore, that I've been seeing for a very long time, since COVID, 2 years now, and he made leaps and bounds in therapy, just very committed to his growth and change, and then was interested in doing ketamine therapy with me. So we did a treatment, and we did 3 ketamine treatments in conjunction with his ongoing therapy. And that experience, actually, he had this moment where he had a eating, what's it called? He was overeating, and it was a big issue. He had
Like
binge eating, yeah. And through his ketamine treatment, it was like this, he just had this moment, he's like this urgency of, this needs to stop, it needs to stop now. And so that was in December, and he's lost 70 pounds since that treatment, and that was all, you know, it was transformative. And he also did the work, but it was a catalyst. It was a moment. It was a pinnacle that changed his direction forever. And so we also use this medicine in treating addiction, because it can help with these realizations, but that it's not just a cognitive realization, it is felt, and that's very different.
Yeah, I think what I like that you added that, you know, it's the catalyst and he had to do the work. 'Cause I think, understandably, we're all looking for, if there's an easier way to do something, we'd all love that, right?
So I think that's human nature, right? Just give me, change is hard, right? The human organism does not like change because it's hard, and we don't like things that are hard. But if you really want to change something, you got to work at it.
And so, as you're saying, that, you know, it's not that the ketamine is going to be a weight loss pill or, you know, a depression fixer or anything like that, but it can really give you a lot, like a catalyst or support to open up new ways of healing that you might not have accessed before. And as you were talking about, it's in conjunction with therapy, so it's not just take it and you're going to be change your life completely on your own. Again, people have transformative experiences taking psychedelics on their own. However, you're going to much more likely have a better experience using the therapy alongside with the medicine.
Yeah, that's going to be the most transformative, lasting change.
I mean, that's something we've actually, you know, since grad school, even with non-psychedelic, but just medications, was always like, almost always the best combination was medication and therapy, right? And so it's the same theme. Again, there's no easy way out of it. You probably will have to do some work. I even remember with that, you know, just antidepressants, when clients years ago would ask me, well, does it help or what is it going to do? And I would say, well, look, it's kind of like you're in a dark well right now. Depression can feel that way. And it's not like the pill's just going to take you out, but right now you feel so deep you can't get out. The medication, if it helps, and it can help some people, it's going to give you some of the boost, but then you're going to climb the rest of the way, but it's going to make it possible for you to get your way out. So it's not like it's just going to fix everything and now your life is good. I also think, as painful and as destructive as depression can be, there can also be insights that people gain through their depression as well. So it's this complex phenomenon where obviously we don't want people to get depressed and have some of the horrible experiences they can have, but not to just think of it as this thing that has to just get erased completely.
It's telling us something. I love the way that you described that. You're in a dark well, and then it helps you climb out, but then you need the therapy to walk forward, right? So I think that's such a beautiful frame. And then, you know, there's always information. Everything is information. My sadness is information.
Yeah, absolutely.
What is it telling me? My pain is information. So we're not erasing this. This is, these emotions are part of the human experience and being alive, but more of like, you know, let me shed curiosity on this and figure out why this is here. What am I going to do about it? Because I have a choice. This is my life. This is my autonomy. And I'm free to live it the way that I want to.
Yeah. I think it's, you know, really powerful, this, you know, even what you're saying, because sometimes to face those feelings, we have to feel okay enough to face them. You know, and people are running away from them or avoiding them or too overwhelmed by them. And so I think sometimes this therapy, or it could be, I'm sure, from the ketamine assisted therapy, that you can face some of the things that maybe you're avoiding to actually get the information. What is the message? Rather than it just hurts or it's overwhelming, it's like, what is it trying to teach me? Learn that lesson. And sometimes through learning that lesson, we can then move forward and not have that feeling hold us back anymore.
Right. And then absolutely. And again, like it is information, right? So when you say, what is the sadness telling me? Maybe it's telling me I need to make a change. Maybe it's telling me I'm really unhappy and I don't like my work and I'm really unfulfilled. And instead of masking it and avoiding it, putting it in a box, let me put it over here, let me self-medicate, blah, blah, blah. Like this sadness depression can actually be very beneficial in helping us make really pivotal changes that ultimately make us happier.
Exactly. Yeah. I think that's a big thing for me. Even on the show, talk about this theme a lot of that. The quote unquote negative emotions are not negative. They're giving you information. And if we avoid them or think the goal in life is just to get rid of them, we miss that very, very valuable information that is there and our body is trying to tell us. But coming back to this, because we just have a few minutes left, this just like, what people, can expect and things. I think you did a great job of outlining, everyone's experience is going to be different. Every clinic might do it in slightly different ways, but, you gave us a nice overview of what people can go through. Is there any like last words you have to people who are considering it? Because, my thought always is like, there's no one size fits all. There's no one treatment or thing that's for everyone. But any thoughts just like, to leave the audience with as we're wrapping things up on this topic? Tough question. I know I put you on the spot.
Well, I think I am very passionate about this subject because of what I've witnessed. How it works in beautiful ways in my own personal experience with the medicine and my transformation in my life. And however, it is not a one size fits all, and sometimes it's not the best.
Sure.
The best treatment for everybody. It might not work for you, and there might be a different avenue that works for you. And so, if you try it, don't give up. Don't say that, this thing is supposed to work and it didn't, and so then I'm, doomed. It's not a one size fits all. So it works well for some people and it doesn't work for others, and that's okay. Everybody's different.
Yeah, I'm actually, the book I'll talk about Wednesday is called The Neuroscience of You, and it's talking about how every brain really is different. Like, there's obviously like anything, there's overlaps and things, but everyone is unique, and that's why SSRIs help lots of people, but then for some people it does nothing and might just give them side effects and hurt them in a variety of ways. So there isn't one treatment that's going to help everybody. But what I think, as we started off the show today talking about psychedelics and how they've had such a bad reputation for decades and it's still coming out of that, I think it's important that people recognize there are alternative treatments, that they maybe have their own biases. I know I have my own. When I would heard psychedelics and they're coming, people are like, oh, that sounds like, that's just like, some of them fade, like some fad or some like something that's like not really helpful. But then like reading the research and seeing people's experiences, I was like, well, this is the real deal. There's, real help here. So again, it's not going to help everyone, but I always think that we want to look at what's out there that can be helpful to me. And I think this is definitely a whole area, and ketamine being one of them, that can help many people.
Right. It's an alternative. Route. Right.
Yeah. And it's interesting that even as we say alternative, because I think that's going to change soon, where it won't be considered alternate. It'll be one of the tools, it won't be
and resources. Absolutely.
Yeah.
Absolutely.
Well, we do have to wrap up for tonight, but maybe we'll have to have you come back on to discuss more things. I'm excited to go through my experience and appreciate you helping to facilitate all of that. But again, that was psychotherapist Anahita Kashefi talking about ketamine-assisted psychotherapy. That brings us to the end of tonight's show. A big thank you to Ghazala here in the studio. Also wanted to make sure you could check out Anahita at Rising Minds Therapy. Is that right?
Yeah. So probably the best way to contact me is email, which is Ana, ANA, at risingmindtherapy.com. Or also you could find me on Instagram at Rising Mind Therapy. Yeah,
I forgot to mention that. Thanks for adding that. Again, big thank you to Ghazala here in the studio. You've been listening to In Session with Dr. Farid Holakouee. Be kind and take risks. Have a wonderful night.